Good evening, everyone. Welcome to the Policy Development Committee Field Affair at Swindon. It is 6 o'clock, so we are going to make a move. Just wanted to welcome everyone, members, officers, and if there's any members of the public, which I don't see any, but the meeting is live broadcasted, so hopefully we do have some members online. Just in case, I just wanted to advise that in the event of a fire alarm, everyone should immediately leave the building through the nearest door and assemble in the car park near Clarence House. And if anybody needs the Swindon Wi-Fi code, it's sound layers slices, spread all lowercase. Thank you. So the first item on the agenda is apologies for absence. I do have apologies for Reti Begum, and I do have Tanka Adam Cover deputizing for Reti Begum, and I understand it Councillor Wilson. Is there any other apologies of absence? No, thank you. Declarations of interest. May I remind members that you should declare any non-interest in any matter to be considered. You should also make a declaration should it become apparent in the meeting that you have an interest in the matter being discussed. Anybody have anything to declare? Councillor Howard.
I'll only just to cover myself that my daughter works for Swindon Social Services.
So the young people's system.
Okay, thank you. And next is the minutes of the meeting held on 4th of September. Has everyone read the minutes, and are there any matters arising? I'm sorry, Barry.
I gave my apologies for last week. Absolutely.
We'll note that. Apart from that, can I take this other true record? All those in favour? Thank you. Public question time. Do we have any public? I don't see any here. Do we have any public question, written public questions? No? Thank you. Okay, the next item in the agenda is promotion of independent living. And I've got Councillor Bowman, and I think, is it Faith Robinson?
No, it's Claire James.
Claire, yeah.
Hi.
Hello, how are you? I shall leave it to you then for presenting this.
Thank you.
Thank you.
So this is the first time that we've been asked to present a paper to the group, which is really good. And I think it'd be great to get some feedback around what you've seen in the paper so that we can understand if we're getting it right. Is there things that we're particularly looking?
Speaker, thank you.
So just to make sure that we get it, there are things you were particularly looking to areas of particular interest, because it's a really broad subject matter in terms of promoting independence. What the paper sets out is the focus that we're doing in adult services, particularly linking back to our strategy around people having lives and not services. Within that strategy, you'll see the priority around maximising independence. That strategy also aligns with our strategy and some of the strategies more broadly speaking across the health landscape as well. The paper also indicates some of the key areas that children's are working on in this space, and I think what we can do more so, as well as focusing on the areas of the paper that we're talking to in the Swindon plan, which is what this paper itself is focusing on. Future papers may include some of the more transformational work that we've got in this space around our next steps around independence. So the paper itself tonight is looking at what we're currently doing and what we're reporting against in the Swindon plan. But there is an opportunity, I think, to talk more in a more detailed way about what some of the next steps are adult services. But it was unclear whether this was a paper from an adult services perspective or a whole council perspective. So I think it'd be helpful to have a conversation about what exactly is it that the committee wants to see in these reports going forward to make sure we get it right. I'm happy to take any questions on it. Anything you would like to add?
No, that's fine, thank you.
Councillor Elliott.
Thank you, Chair. I had the privilege of having a briefing on this from Claire and her colleagues as the shadow for adults and housing, and I am really pleased. I think this is an absolutely positive policy, and I think it's going in the right direction. We look at the deliverables, and yes, I know that there are comments here that it has taken a little longer in some areas to get the groundwork underway. But, you know, we're looking at things in a very positive way, and I think we should commend, personally, I feel that we should commend the department for this work, which I think is very good. And I look forward to hearing its progress over future months. Thank you, Claire.
Can I come in? So, are you referring to the working together policy? Yeah, great. Thank you.
Anybody else? Oh, well, can I actually ask, I mean, in terms of the service, yeah, independent living, it does seem that obviously you are having measured targets as well. So in here you've got, 381 out of 573 had achieved additional independent. I mean, how do you normally measure them, and what is it actually? It's got to be a silly question. I mean, when I look at these numbers, are we talking about people living independently on their own or with their family setting?
It's not a silly question, but it is a complicated question to answer. So there are two really key measures that we have to measure individuals' independence, that are the sort of metrics, actual numbers. One of them is driven out by our reablement service, where it's called a MOTO score, where they will take a functional assessment of somebody's abilities before they enter into a reablement service, and then they will do it again at the end of it. So they'll apply scoring to how many can you transfer independently? Do you need one person? Do you need two people to help you? Do you need this piece of equipment or this piece of equipment? How long might that transfer take you? How far you can walk? So really practical functional measures of independence, and they test you as you go into a reablement service and then as you come off a reablement service. So we get an idea of how effective or how impactful that service has had. I don't know the name of the score in the occupational therapy service, but it's a relatively new metric that's been developed by the principal occupational therapist, but it runs along a similar score where you'll have a one-to-one conversation with your person that you're supporting, come to an assessment of that level of function and then retest it at the end of the intervention. But the occupational therapy scoring is a little bit and experimental, but the reablement one is quite a solid score. It's used by health colleagues as well.
Can I also just say, I mean, how much actually do you work with the family? So, I mean, the immediate family of the person from them.
Yeah, it very much depends on what the person wants. So in adult services, we always have to get consent from the adults. So if for that adult it's important to have their family there, then absolutely we'll be talking to their family. For some adults, they don't want their family in that conversation, and we have to respect that right at that time. So it really depends on the family, on the individual's choice.
Thank you. Anybody else got anything to raise, Councillor Howard?
Thank you. Yeah, I think it is. It's got an essential, isn't it? So sticking to the adults, I wondered about the occupational therapy, what sort of wait time is for people on that. And I just keeping an eye on the performance measures in 3.5. I just think it'd be nice to keep an eye on those as we go forward, maybe. And I wondered who else is monitoring those. Those are the adult bits.
So in terms of, do you remind me of the first question?
The occupational therapy, how long
the waiting is. So again, it depends on what the presenting need is. There are some individuals who will be referred today, who will be seen today because they're in an urgent need for an assessment. There will be some individuals who could wait for a number of months without having a significant impact on their well-being. So what we tend to focus on is prioritisation of need, and then making sure that those individuals who are waiting well, and that we understand the impact of the wait, that we're really transparent about how long they may have to wait, that we've got a letter that we send out to be really clear about the conversation we've had about the wait, signposting them to lots of other agencies for support. So there's a real focus on waiting well. and prioritisation of need to make sure we get that right. In terms of the new data, so 3.5, you say.
So we've only got this, the quarters are followed. I just wondered who else follows it and do we need to look at it again?
Yes. So it's looked at in our own, in adult services, in our SLT performance, but it's also being reported into the Swindon plan. So at the moment, that's also looked at. So we've had our first Swindon plan fairer mission board today, co-chaired with Kirsten Nelson and Councillor Grant. So it's all in there in that performance framework as well.
Like, just come back on the occupational therapy. So there must be an initial assessment then, if they're waiting well. So how quickly do they get that initial, or is it just on the referral? You base it on whether they.
So the referrals will come in.
So they're quite thorough referral.
Yes, thorough referrals will make it a lot easier. We have a duty service that just look at all the referrals that are coming in. We also have the ability to signpost people off to a trusted assessor from our equipment stores. So if it's quite a simple request for a piece of equipment that isn't going to require a home visit from us, we can just hand off to the trusted assessor and they can get equipment in next day or same day or next day if required. So we've got it's a very robust duty system. I think one of the future transformation spaces for adult services is how do we lift that sort of OT side door, occupational therapy side door, into our main front door, so that you don't have to have a conversation at the front door and then be referred to the sort of occupational therapy side door, and that our front door conversations become much more therapy led and therapy first. So before you come into adult social care for an assessment of your long-term need, you've had a conversation with the therapist about, we were doing this yesterday, how can we get you back to independence to do it today? What equipment do you need? Let's come and have a look at your environment and see if that would help. So we would really want to push that re-enrollment and therapy offer right at our very first front door. That's a big focus for our services this year now.
Yeah, Councillor Paddy, and then followed by Councillor Alonso.
Thank you. You talked about children's youth service, which is great. How many children are you supporting? Is there like a waiting list, and what do you do about the people who I appreciate it's very far stretched with children who don't necessarily be able to get to those centres, and measures you do to accommodate them?
I would do, because that's sitting in children's services. I need to take that question away, Councillor.
Right.
But if that's noted, I'll absolutely do that.
Can we get that noted and circulated?
Thank you. Yes, sure. Councillor Adam Cooper.
Thank you, Chair. I also have a question about your performance measures that are outlined in the table 3.5. So my understanding that these are new measures, and obviously that seems to be like it's a bit of a mixed picture where in one target, the first measure, you actually already above your target, the other one you're not meeting. So I was just wondering, how were these targets set? Because it seems like this one you kind of reached very quickly, whereas obviously there's a lack of progress in the other one. And are they consistent across other authorities, or are they specific to Swindon? I just want to get a sense, if they are set at the right level.
No, it's a good question. And our principal occupational therapist, Sophie, is really clear with us that these are really new. And these have come basically from the principal occupational therapy network. So there isn't a really clear benchmark from this. And even in the College of Occupational Therapy, they don't set standards for local authority occupational therapists. It's fair to say that most of the focus nationally on occupational therapy sits within health services. A huge percentage of occupational therapy will be employed by health staff and working in the NHS, for which there is more sort of standardised and benchmarked data available. There really isn't very much for local authority. So this is Sophie trying this out for the first time. She will be actively reviewing that and seeing what we need to do to stretch those ones that we're already at, and then understand the potential to creep into the other ones. But it's very much a new way of working in adult services with those measures.
That's useful. Thank you so much for your explanation.
Thank you. Can I also say, the recipient of the service, do we get any sort of survey to suggest what their feeling about the services receiving, or do they feel that there could be more done to improve the service?
Yeah, so there are several measures in terms of how we can get that information. There's national surveys that go out every year asking people who use adult social care what their experiences of adult social care are. We've got also what we call a local survey, which is called the My Care, My Views survey, which I think is better than the national questions, because the questions we asked there are what we call the I statements, and I statements were statements devised with people with lived experience of care and support and the Think Local, Act Personal sort of think tank. And they will sound like, I feel I am treated with respect, I feel safe, I have choice and control. So they're very much driven from the person's perspective. It's the I statements that we use in our adult social care strategy to measure ourselves. So the My Care, My Views survey is written in those I statement questions, and we get a return every intervention. We send that survey out. We're almost now at about 400 returns back, which is significantly more than the return that we get from the national data. Last year, we were able to add some of those I statements into the national data set, so the government will allow additional questions to go out in that national return. It's normally not possible to do that because they have to go through quite a lot of rigour to make sure that they're good enough quality statements and questions to ask for. So I was really pleased last year when the government didn't even ask any questions. They just said, yes, they put that into our. So we've got a national return with I statements in it, but a much broader My Care, My Views survey. And all of that is reported into Scrutiny every year. So the Adults and Children's Scrutiny Performance Pack has got our data in that space.
Thank you. Obviously, those people are quite vulnerable in our society. I mean, if somebody wanted to raise any issues, how would they get to you? Because do they have some sort of procedure where they can actually raise an issue if they wanted to?
Two main ways of contacting adult services. If you've got concern and you're worried that somebody is at risk of abuse or neglect, then there's the online referral for safeguarding that is available. The public can log in and do that. And that's also got the contact details there for our adult multi-agency safeguarding hub. More generally, if you would want to just have a conversation with adult services, the main customer services will field calls up into our initial contact team. Both areas were super busy and receiving those calls all the time, and then looking at those referrals and making the judgments about where they need to go from there.
My question is actually, if the vulnerable person himself wishes to raise any issues with us, I mean, is there any process for them to do that? I mean, are they aware that they can also raise issues if they need to?
Yeah. So you're able to self-refer into adult social care. You can self-refer into safeguarding. You can absolutely use the My Care, My Views survey. If you're working with an agency, we get quite a lot of agencies like domiciliary care providers who act as an advocate for their person. So they will say, I'm phoning you because we've had a conversation with Fred and he's worried about X, Y, Z. So we get a lot of support calls coming in from providers, but family members as well. But every person we contact will be given our information, so they should know how they can contact us. One of the things, again, for the future, how do we make ourselves more visible on our website? How do people know what to search for? And how can we be much more outward facing in terms of should be your expectation of adult social care. This is what you should get from a rights based perspective. And this is what you should do if you're not getting it. So there's some work already started with the web team about making that offer a bit more rights-based and outward-facing.
Anybody else? Yes, Captain Howard.
Well, just on the children's thing, the early help, which I know will have to be taken away, but it says 3.1 that the project has been successful and there's a proposal to extend it, but I don't know how we're judging this success. I don't know if that can be taken back and we can have some feedback as to how we're judging the success.
Is that okay?
Yeah, absolutely.
Thank you. So apart from that, no further questions. Anything more to add, Councillor Baldwin?
I just wanted to ask that obviously this request must have come from this board. And is this in the format you wanted it, or is this the sort of report that you wanted from adult social care?
I was going to ask members whether they want a further report in due course, or maybe in 6 months or 9 months, or are we just quite happy to note the report today?
From my point of view, I think it's good to focus on one thing, so adults rather than using adults and children would be helpful. And I think if it's being monitored in another board, then we don't necessarily need to see it again. But I think if there are specific things that we have questions on, like I was about occupational therapy, because I've heard of that from a couple of residents, but they seem happy with the service. So I just think if something comes up, then we can have a report back. But I don't think we necessarily need to report back just for the sake of reporting back if it's already going somewhere. That would be my view.
Councillor.
Thank you. I would probably just comment with my other head on, I'm the chair of Children's and Adults Scrutiny, and the help is actually coming to February committee for discussion. So if any members of this committee have any questions they want to ask, you can always pass on through me or the other committee members, so we can do it that way.
Thank you. Okay, well, in that case, we'll just note the report at its time. Thank you very much for presenting the report, and thank you, Councillor Bowman, for being here. Thank you. Okay, and the next item we have is children and young people health need assessment. We've got Councillor Dixon as the cabinet member, and I think it will be Caroline Little who will be presenting the report. Hello.
Yes, thank you, Chair. I'm going to introduce the item. I just want to pick up on, how the committees overlap. So I know this policy committee has taken on more of a scrutiny role, and as Councillor Cover mentioned, there's some things that the Children and Adult Scrutiny Committee are covering, and I think and some of the public health probably comes under health and well-being as well. So I think there's probably further discussions needed between the chairs of the committees just to make sure that the best use of each of the committees and that they can then focus on the important areas you want to focus on. I know today we've got 3 really heavy meaty items, and you've got a report on public health and an appendix that's 157 pages long. So I think you may think about whether you want to concentrate on a specific element of this, and for us to come back in 6 months or longer next year to look at something specific once you've had time to consider. I just wanted to introduce the report, and then Caroline will go through her presentation. And just say that it provides an overview of the health needs of children across Swindon, and that the committee is recommended to take note of the areas that we've identified and the plan on the areas that we're looking to improve in Swindon. It's children's health has been identified as a priority in the Swindon plan underneath our mission to build a fairer Swindon. Just scrolling through, I picked out something important. The priorities for health in Swindon under point 3.6, which I'm sure Caroline will mention: social, emotional, mental health, children's development and education, access to nutrition, food and exercise, and oral health. And those of you that look at the Swindon News and Facebook campaigns, you'll see we've got a campaign around children's and dental health, because it's really bad in Swindon, and it's an area we need to concentrate on, as well as some of the other things. So I think if I pass over to Caroline for her presentation, and then if you have any questions, we can sort of look at how we can answer those or take it away further.
Good evening, everybody. So my name is Caroline Little, and I'm Head of Children's Public Health. I've got a presentation to run through with you today. As Councillor Dixon said, it's a very long report and there's a lot of data to get your head on. So hopefully this will provide you with a bit of a snapshot of some of the headlines and give a bit of food for thought around what's in the report. And just to acknowledge my colleagues, Joe Dallas and Deb O'Kepper, who did the majority of the work on this report. I'm going to take any credits for that. Okay, so the children and young people's health needs assessment. So as Councillor Dixon said, this is a population health needs assessment. So we're focused on looking at whole groups of children and young people and what their health needs are, not individuals And we're also looking at health outcomes as opposed to health services. So we don't look at the NHS services in any detail other than where that's an indicator of overall health. We're obviously interested in inequalities, and I know that will obviously be of particular interest here today. It's a significant piece of work, trying to understand the health needs of the entire population when we think of our youngest residents. So we split this piece of work into 3 stages. The report you've got today is the first piece of work, which is data driven. And this is really a snapshot in time of the data that we had available, and that's drafted the priorities that have been mentioned. The second phase of the work, which is where we're at the moment, is around engagement with children and young people. There's a fantastic piece of work that's been done by our children and young people. It's a young person-led engagement piece of work by Way UK. And that feedback will form our Director of Public Health annual report this year. So that's coming up fairly shortly. And that really brings some richness to what we're trying to understand around those health needs. Ultimately, obviously, we want to move towards developing a strategy around health improvement. So it is trying to understand where we as a council can act around health improvement on those priority areas, and obviously also where we need to work with partners to be able to address these. So just in terms of the scope of the work, it's very difficult to define, I would say. So it's a very lengthy report, and it could be much more lengthy, I would say. So it is very much a snapshot. I'm trying to get that balance between going into the detail that's required, but still having an overview. So these are some of the themed areas that we'll look at throughout the piece of work. We try to look at data from pregnancy up to the age of 25, where the data was available, and we were particularly where there were areas where we could focus on prevention. This is just a disclaimer, so to note that, again, there are limitations, obviously, to this piece of work. It is very complex, and we did have limited data, so particularly in certain areas. So for our under 5s, we have fairly limited data, and also for the 19 to 25-year-old population, again, the data was fairly limited there. It does link to a number of other health needs assessments in certain areas. So usually we would look at a topic when we're doing health needs assessments. So we look at oral health or mental health. So in those cases, we do link to those existing health needs assessments. So very briefly, just thinking about who our children and young people are in Swindon. That graph on the right-hand side there looks at projected population growth. And actually, it's fairly static for our child and young person population. So we're not looking at huge increases in numbers of children and young people over the coming years. However, we do have the largest child and young person population in the southwest. And as you'll well be aware, we've got an ageing population in Swindon, so the proportion of children and young people will decline over time. And that would be important, obviously, for the council in terms of considering where its resources are best fit. The graph on the left-hand side there is just one indicator of looking at the increasing and growing diversity across Swindon. So this looks at live births by mother's country of birth. So these are all children born in Swindon. The yellow bars at the bottom there are mothers who were born in the UK. And you can see the really significant shift there over time. So just thinking about where our children and young people live. So you'll recognise on the left-hand side there, this is a map looking at our areas of deprivation. So those areas that are darker red are the more deprived areas. On the right-hand side, this is where our children and young people live in Swindon. Again, those darker areas, the purple areas, are where we've got greatest concentrations of children and young people. And I think what that particularly demonstrates is there is a significant range of inequality across our children. So we've got some very heavily concentrated in poorer communities and also heavily concentrated in some far more wealthy communities. We've also got 10.1% of households in Swindon who are lone parent households. And again, they tend to be based predominantly in some of our poorer areas. So being a lone parent is a significant stressor in itself. And when you bring poverty into the midst, that can also make life more difficult for those families. So just going over some of the headlines, as you'd imagine, there are areas to celebrate and areas of concern. We do tend to see poorer health outcomes in adolescents. So when we're looking across the life course, this is where we seem to see most of the poorer outcomes. But again, that's with the caveat that the data is fairly limited for younger children. There are particular groups of children who experience poorer outcomes, and there are also groups of children who we know are likely to face greater disadvantage, but where we don't necessarily hold that data at the moment. Okay, so these are some of the areas where we're doing quite well in Swindon, but I would suggest we would still want to aspire higher. So in pregnancy, we have relatively low rates of smoking, and also maternal obesity is relatively low in Swindon. Smoking in particular, ideally we want no smoking in pregnancy because it is so significantly harmful to an unborn baby. We've got a higher than average uptake of vaccinations during pregnancy as well, and our breastfeeding rates are pretty good. I would say, however, the English average isn't great. We know we aren't fantastic at breastfeeding compared to some of our other countries, so we would still want to aspire. Physical activity targets are generally met, which is positive. And at the time of writing this, our children with special educational needs and disabilities were having plans put in place in a timely manner. So some of the areas of concern then are tooth extractions, as mentioned at the beginning, particularly in 6 to 10-year-olds, is quite high. We also have higher admission rates to hospital for self-harm, substance use, alcohol-related hospital admissions and use of cannabis. Our vaccination coverage is lower generally, and particularly for the preschool age boosters and the HPV vaccine, which is for secondary school students, that is a bit lower than we'd like it to be. There are some challenges around childhood development and educational attainment, and we've got rising obesity rates in Year 6 students. For the younger adult population, sexually transmitted infections are highest within that age group, and the rates are higher in Swindon than the South West. So this is where we've led to these priority themes being identified. They've been identified as priorities because they have the potential to affect a really significant proportion of the population, where we know we need to do better, and where we know we can make a difference. So these are all areas where we have the ability to impact. So I'll just take each one briefly. Social, emotional, mental health. This is obviously a very big topic, but just a few indicators here. So if you look at, I appreciate you won't be able to see that, it's very small from over here, but that graph on the right-hand side, it's at hospital admissions for self-harm in 10 to 24-year-olds. And the orange line at the top there are the Swindon hospital admissions compared to the South West in the middle and the purple, and the bottom line is the England average. So you can see we are significantly higher for our admissions for self-harm. The graphs on the left-hand side start to look at that data in a bit more detail in terms of deprivation. So most deprived towards the left-hand side and least deprived towards the right. The difference in the graphs is that the top bar graph there looks at the proportions of children and young people and where they come from in terms of deprivation. And you'll see that in terms of absolute numbers, we've got higher numbers of children and young people presenting actually from our more affluent communities. But when you start to look at the data on a rate per population basis, which is the bottom graph, you'll see that there is an association there with deprivation, which is what we would expect. So it's just a pointer really that, you know, some of the data can be a bit misleading if you don't look at it quite carefully. Also just there, we've got over a third of the Year 10 cohort in our most recent survey said they didn't feel they had healthy ways to manage difficult feelings, and 8% felt they didn't have a single identity. Development and education, I won't go into this in a great deal of detail, but the headline is that we are generally just below average across the board. So that's really early on, so at the end of reception, children aren't achieving as good a level of development as their peers across the country, and that continues throughout the age ranges. And when you get to the higher levels of education, so certainly A levels, for example, we tend to be much lower than in Swindon. Looking at healthy weight then, so this is what we've retermed deliberately access to nutritious food and exercise, recognising that children obviously don't have a great deal of agency in determining their own weight. We do know obviously that healthy weight is a really important factor in terms of children's health, but also for their future health as adults. The graph here looks at prevalence of overweight, so in both year 6 and at reception on a ward basis. And again, you'll see it really strongly correlates with deprivation. So those darker red dots are the wards where you've got children in both year groups with higher levels of obesity. Oral health finally. So again, we've got exceptionally high levels of hospital admissions for tooth extractions. So the bottom graph there looks at Swindon compared to our neighbours, the South West and England. And again, you may have seen in the news recently that this is a particular concern for us in Swindon. We also have fewer children accessing NHS dental services in Swindon than some of our neighbours and than the England average. I should also say that again, dental decay is more prevalent in deprived communities and is also a factor in terms of ethnicity. So some of our Asian families are also at greater risk of oral health. So thinking about children at risk of disadvantage, these are the ones listed, and they are the young people you would expect. I suppose the obvious caveat to put in there is that obviously a number of those children will cross a number of those boundaries, and obviously the more risk factors you might have, the greater disadvantage you're likely to face. So again, thinking about inequalities, starting to map out what some of those inequalities might look like for some of our communities against some of those priority areas. And this is very much here to prompt thought and discussion. It is not an absolute by any means. So the orange boxes are where we do have data locally that suggests there are inequalities. The green boxes are where we don't have the local data, but we do know that there is strong evidence that those children and young people are likely to face disadvantage. So, for example, our LGBTQIA+ children and young people are much likely to have poorer mental health. We don't have that data locally. The other thing to bear in mind is, again, some of the metrics can be misleading. So we've got white children there, suggesting there is no representation of white children in terms of their development and educational attainment and their social and emotional mental health. Particularly with social and emotional mental health, this may just be because white children are more likely to access help, and that will be for a whole range of reasons. So again, it's still to be taken with a bit of caution. Another thing that was quite stark to me when we did this piece of work was looking at some of the gender inequalities. So some real differences between our girls and boys. So that for the girls in the pink on the left-hand side, excuse my stereotypes, girls tend to engage in more health risk-taking behaviours, whereas boys tend to have more physical health conditions. And of course, just to note that more and more of our children and young people are identifying differently. They may be trans, non-binary, or as another gender, and we have no data for those children and young people. And finally, I've just pulled out this slide again. Apologies, you won't be able to read it, but this is a vision of child health that was from the Royal College of Paediatrics and Child Health. So these are all children's doctors and paediatricians, and actually their vision of child health doesn't mention health anywhere in it. And if you were to look at those boxes in a bit more detail, these are all things that we can act on as a council. So the next steps, the health needs assessment has been published. We are working on a prettier version. It is still available and is able to be used currently. The engagement work, as we've talked about, we are imminently expecting that report from our children and young people, which brings a level of detail to understanding those needs, but also some suggestions of what they would like. That Director of Public Health report will be coming out, as I say, in the next month or so. And then we'll be working on the health improvement strategy during the first quarter of the next financial year. So I'll leave it now open to any questions. I've got these questions up just as some pointers for you, really. I'm interested to hear whether these are areas that resonate with you, whether these are things that you hear on the ground, and any kind of background information. Obviously, very happy to take any questions.
Thanks very much, Caroline, for the presentation. Does anybody want to come first in any question?
On the accessing dentists, is that the case of they don't want to go, or that there is no spaces?
It's mostly the latter. So it's the lack of available NHS dentists. We do know that for some children and young people, it can be difficult going to the dentist. So we've done some work, for example, with our children who were looked after, where they've had some dental phobias, to be able to enable them to access their dentist appointment. And actually, we did really well with access for that group of children. But broadly speaking, it is around the general access to NHS dentistry.
So, may I ask another question? How many children are currently in the waiting list who cannot get into a dentist at all? What action is being taken for you?
Yeah, it's a good question. I'd have to have a look at the actual numbers to work that out. We could look at that because we've got the percentages, so we would be able to look. There isn't a wait list as such collectively, so some practices will hold waiting lists, but I imagine there are a whole lot of families out there who don't even try. Yeah. They just don't think they'll be able to get in. So there'll be greater need out there than maybe demonstrated on the waiting list. We're working really closely with our colleagues at the Integrated Care Board, who have responsibility for commissioning dentistry. So they are looking at a whole range of measures to try and improve that. So one of the issues for NHS dentists is the rate of pay they get for the activity. So they are looking at an enhanced rate for children and young people, which is really positive. We're also looking at schemes such as child-friendly dental practices, which would address your other concern around those who aren't able to access a dentist even when there is a space. So there is action being taken locally, but there is a national shortage, and I think it won't be a quick fix in this way.
So if we brought this back and say, let's say the next 12 months, as an example, where do you see you see a difference, and where do you see it? Because obviously we look comparatively are high as for neighbours and beyond national average. So the actions you are taking, where do you see this in, say, 12, 24 months? Where do you see it?
So the really nice thing about children's oral health is that there's a really strong evidence base around what works. Yeah. And it's one of those areas in terms of prevention that actually you see a relatively quick return on that investment. Yeah. When I say relatively quick, we're probably still talking 5 to 10 years. So what we are hoping to do through the work of the public health team, and particularly the work around the council, is to try and prevent that dental decay in the first place. So there's a whole range of activity that's going on in that space. And I think I'm due to bring a report actually to the next committee, so we can talk about that in a bit more detail. But the hope is that prevents the dental decay, which then reduces those admissions for toothache. So over the next year to 2 years, I would like to see some really of some of those evidence-based programs that we know work. So, for example, the supervised toothbrushing that was in the news just this week. So we'd like to see more schools engaged in that work, more children having that access to fluoride in the day. And we know then that within years to come, we should see those rates come down.
You've actually lost the children today then?
Sadly, it's very difficult. So for those children, obviously, who are already having their teeth extracted, that they're obviously in a very difficult state. What I would say is we are looking at doing some work with those families. So you may have a sibling who's had their teeth extracted, who may have younger siblings, and in which case, absolutely there's an opportunity for intervention there. But sadly, when we're looking at some of those hard measures, it is too late for some of the children. But of course, any child that comes into contact where there is significant decay will need an extraction, and then they still work with that family around the health promotion that's needed.
Okay, thank you.
Thank you. Caroline, I do practice. This is a big piece of work, and this is basically a whole council approach work from my point of view, I mean, as a policy development committee, I wanted to focus on a few things. And I wanted to particularly focus on health and education, particularly mental health and obesity. And I particularly wanted to focus on the affected areas, the higher deprivation areas. So in terms of education, I mean, I think in your report, it was quite clear that people who are living in areas of deprivation, are much more in a risk of not going to even secondary school in some cases, well, not even finishing their secondary education, forget about higher education.
Yeah.
And we've also identified that these are the people who will always have a struggle to overcome, to climb up to that level where their income will be in a position where they can actually manage it. And I think that's where I wanted to focus more, led by data rather than, we know that is the case. So how can we actually see a data in the future where we can actually see the students of those particular areas, work on partners, depending on partners, that, they are improving their educational data. Let's say where we are today, and how can we ensure that we are seeing a progress year on year? That is the education point of view. And the second point of view, when you come to the health, I mean, you've also identified that obesity is a big challenge in areas of higher education. And we all know that obesity is a starting point for other diseases as well. And what can we do more on those particular areas, targeting these particular areas, with data of why are we seeing more people with obesity and how we can overcome them? How can we educate them that obesity leads to diabetes, high blood pressure, and all that? And these are the areas where we have a multicultural people coming from different backgrounds. What have we got for them? I know Dan have raised this, and I'll come back to that. And also in terms of the mental health, I know, again, people of those particular areas have a high risk of mental health. What are we doing, and what is the school doing about that? Well, again, what does the data say today, and what would the data say a year's time? Thank you. More than happy to bring in Councillor Grant if he wishes to come now, or more than happy for Caroline to answer the question.
But it's just on that particular point, which is a wider thing, Caroline, and it's just a suggestion for the committee. Oh, yeah, sorry. Just before the committee, I've just had a look at the work plan and it was quite full, but you only got to one more meeting of this, haven't you? I would suggest that you invite Emma Kane, who is the senior consultant in public health, to come and give a presentation on something called Core 20+5, which is the national NHS approach to reducing health inequalities, which focuses on that core 20 is the 20% most deprived areas in Swindon, and some work's already been done on that, and those areas are highlighted in Swindon, so I can tell you what they are now, but they are all the ones you think they were, and I think that might well be where we as a council are going, because certainly within my portfolio, the job of the communities, strong communities portfolio, is to keep people out of adults and children's, and the way we do that is by working in the community. So so if you, I would suggest that you invite Emma Kane along to give a presentation on Core 20+5. I think you'll find that's useful from what you spoke to me previously. And while I'm here, if I can also suggest another thing that came out of Caroline's report, is that we had a very long discussion at the Health and Wellbeing Board yesterday about mental health, particularly in young people. One of the continuing issues that we have in Swindon is the very high levels of self-harm among people between the ages of 15 and 24. And I think it was fair to say, to those people who were there yesterday, that we didn't really have an answer to why that was. We're fifth, basically, in the country on self-harm, and that seems to be. So it might be, now I think there was a move for officers to go away and have a deep dive into it, but it might be something that you might want to consider going forward to look at it yourself and the policy aspect. And apart from that, Chair, I'll go over consider it back there.
Thank you. Well, I mean, while you are here, is MIK able to answer the educational part of it as well, where, as I said,
what we're looking to do is to use the core 20+5 across all aspects of the council. So it's not just, whilst it's health inequality, but health inequalities relates to housing, relates to crime and antisocial behaviour, relates to the whole Fairer Swindon portfolios. So it can, and integrated communities in itself. So yes, she will be able to map that across the whole of the.
Councillor Howard says.
Yeah, just one small thing before I come on to the priorities, and that was 3.10. It says it's about swimmers looked after children who experience dental phobias, limiting their access to dental care. I mean, I read that, and to be honest, I was horrified, because there are children, there are looked after children, and I hope it's not limiting their access to dental care. And when you spoke about it, you spoke as if something's been done about that. And I speak from experience, actually, as a health visitor. One of my little ones they were foster care, they didn't see the dentist permission and they needed teeth out. And actually, I think it was the foster carer's phobia, not the child. When he moved to a long-term foster care, he had dental treatment very quickly. And I blame myself for not chasing that and doing more about it. So I hope we're working with our foster carers and in every way possible to get these looked after children seen and to have their phobias dealt with. That's one of the things we surely can do as parents. And I think that's what I read here. So I'm just can you confirm that we're not limiting their access to dental care? We're actually kind of working them through it.
Yeah, absolutely, Councillor. And again, it's the limitations of this report, really, because we're just looking at the outcomes, and there is a whole raft of work that's being done around these priority areas, as well as a lot more work to come. But yes, on that specific point, actually, we do really well in Swindon for our children who are looked after. We actually have much higher rates than the national average in terms of their dental access. We've got an excellent team at GWH who will always see children who are looked after as a priority, so they do have very good access. And as I say, where that dental phobia has been identified, we've done some work specifically with those children and their families to enable them to be able to access. Yeah.
And then if I just come up on the, I mean, I love this report. I just love it. I mean, this is my, public health is my thing, really. I'm reading it. Whoa. I'm wanting to share with everybody. I've got so much stuff highlighted, and I was really pleased because I highlighted all these things, and then at the end, they tied up with what the report said, which I suppose is how it should work, really. But I agree, mental health, boys' mental health, and also I felt supporting parents. There was parents wanting to know what to do, and we not having the information. So I don't know if we can include that when we look at the mental health. And I was also horrified about the partner violence. 29%, I think it was, girls had experienced, and that's just frightening. But we can only, focus on so much. I think for mental health, and particularly boys' mental health, I think, and perhaps with self-harm and widening already. See, it's huge, isn't it? But anyway, thank you very much. This was really, a good meaty read. And there's so much to do, but I think maybe focusing on the mental health, self-harm, and for the boys, and also supporting the parents as well. I don't know if that website is, I can't remember, I didn't view it, but whether there's parents' parts on it, but maybe we need to promote it more, I don't know. Something to look at.
Thank you very much. So on the parents' point, first of all, so again, when we try and consider the scope of the report, we were deliberately thinking, should parents be interested? Yeah, obviously parents and carers are such a significant influence on the children and young people. We decided to keep it out, but just again, purely to try and give some boundary to this report. So as you say, it could be even bigger. That's not to say we don't want to do that work. So again, that is another piece of work we have in planning for this year, is trying to understand parental views. So what are the issues for parents? And we have some anecdotal evidence around that, but we don't have the sort of hard data behind it yet. So for example, those hospital admissions, I spoke to the matron in the children's ward just the other week, and she was saying Some children are staying in hospital longer because their parents feel so anxious about bringing their young people home when they've self-harmed, but they don't actually have a clinical reason to stay in hospital. So, you know, again, that's a really clear example of where we could be doing so much more to support our parents and care to be able to then support their children. Coming back to social, emotional, mental health, again, it's huge, absolutely huge topic. And it's great that you pulled out the boys and men's mental health. So we know there are some significant inequalities there. Some great work's been done on that just recently. So we did some really detailed work around understanding boys' mental health needs. There were surveys that went out to schools and focus groups. And we had a conference towards the end of last year with partners who were really engaged. We were completely oversubscribed. And again, that links, obviously, when we're talking about healthy relationships, exposure to the domestic violence, so it all very much links. And so, yeah, there's some really good partner buy-in to do some work around boys and men's mental health specifically. And it feels like that's the way forward, I think, with that work. It can feel so big and overwhelming, but actually if we start to look at those specific communities and understand the differences and needs, then we can do the targeted work that hopefully will be more meaningful. Thank you.
Thank you, Chair. First of all, thank you so much for your presentation. I agree with Councillor Howard. It's very neat to forward. It's a good read because it's lots of information, very useful information. I have two questions. First one is for you, and the second one is probably more towards the committee member responsible. So it was highlighted that when it comes to education, health and care plans, they are issued in Swindon at time of infection, which is positive. I was just interested to understand if this applies across Swindon as a whole, or would it be certain areas where there would be delays in these plans being issued? Again, just trying to get under that kind of umbrella of, you know, are all children being equal when it comes to ensuring this plan? So we have the type of data that we can actually drill down to.
So this is, again, it's quite a big question, actually. So again, it's where you look at the data and how that can potentially be misleading. So I say one thing I would point out is that this was a snapshot in time, and that unfortunately that timeliness of the issuing of those plans has reduced slightly. So, you know, it's one to watch at the time we were doing well. What we do know is, again, so families who live in more affluent areas are more likely to get those plans. It's not necessarily an indicator of the whole level of need. So children from poorer backgrounds are probably less likely to have those formal plans and formal support they need in place in the first place. So whilst it's great if we are delivering the plans and we're doing it in a timely way, I suppose it's also understanding that the plans are only one indicator of that level of need. The other thing we'll see is that children from poorer backgrounds will have less accurate diagnoses of their conditions. So, for example, a child from a more affluent area might be more likely to get an autism diagnosis. So it tends to be harder for children from poorer families to be able to get that diagnosis. So looking at those, the need around special educational needs is really challenging. And we do have particularly high demand in Swindon for those services and that support. Again, that's a national issue, but in Swindon we do have particularly high levels of demand for that support. So yeah, I'm not sure if I quite answered your question, but it's a tricky picture.
Yeah, thank you so much. Yeah, and it kind of leads me to my other questions, because there's so much more that needs to be done to level up Swindon across all areas, because we know there are areas that are very deprived. So obviously you outline all the priority areas. Now you're going to progress to doing strategy, so they will come out first quarter of the next financial year. Then I suspect there will be delivery plan. We are at the point where we're sitting at the budget for the next financial year. So I just wanted to make sure and get the assurance from the lead member that there will be budget allocated to support the delivery of this work. So that's the question to the lead member.
The answer to that is yes, in twofold. One is that a lot of Caroline herself is part of public health. Public health in this council is not funded by the council. It has, memory serves, it could be £11 million budget or thereabouts, and that is funded directly by the government to public health. So, and that budget has increased, I think, a little bit this year. So the money for the public health element of it is stable, as it were. We will be able to use that hopefully in my core 20 plus 5, whatever, going forward in that sort of strategy. As far as the budget is concerned, without sort of disclosing details of the budget, I think cabinet members here will agree that we have a view that all the long-term investor save monies that we put into the council, put into the budget over the previous years will continue, and they won't be cut, because we see that sort of, if you cut those things now, then further down the line, we're going to be here with what you just, it may well have been if we'd have invested to save in early years much earlier, then we would have been in a much better place with children's health as it is. So those two things, in answer to your question, is there will be a budget for it.
So just a quick follow-up. So my understanding, the pot is there, but it hasn't been prioritised because we still need to wait for the strategy to understand what the priorities would be. Is that right?
There is a health and wellbeing board strategy, which is the overriding public health strategy that affects its council, and that has the priorities there are mental health, obesity, and maybe those correctly, smoking and alcohol, and those three things. Now, again, what came out of the health and wellbeing board yesterday was that we might want to look again at the strategy and see what else can be included in those things. But the important thing is not so much Swindon Borough Council here, because health is something that goes across authorities. So included in that health and wellbeing board is the integrated care board, which is the NHS essentially, Great Western Hospital, the police, probation, and the ambulance and the fire service. So there's a number of, and if I had my word, we are on, this is a public meeting, isn't it? We probably need as a council, because we are the driving force behind that body, to try and open discussions with those other partners on them doing more in this field, and possibly then them contributing more in a financial sense.
Thank you.
I think we should acknowledge that, whilst it is a good report, there are some really concerning points, things like pupil absences at school, rocketed, children with alcohol, knife crime at 30%. These are also concerning things for myself. I'm sure that the rest of the committee agree with that, and I'd like to see more work done about that, because obviously these things are rising, and we're seeing news all the time. And talk about the reasons why, and these are like getting us blind in the face, really.
Yeah, thank you. As I understand, obviously, in terms of the core 20 plus 5, obviously we've got Emma K. So if we can request Emma K is present at some point in the future. And in terms of the wider topics which we've discussed today, is the committee willing to take any deep dive in any particular area? No? Councillor Howard first, and then Councillor.
Well, I thought I'd like to think for mental health, particularly boys' mental health and self-harm, but again, I don't want to duplicate, but it sounds like we just need to keep an eye on that. I mean, I take your point, Councillor Perrin, there is huge concerning, and I'm equally worried about the part of violence. And maybe if we can deal with the mental health, maybe some of the knife crime and part of might improve. I don't know, but to me, I think that's when I read through this, that was what shouted out to me, and yeah, that's what my bid.
I'm only deputising, but exactly what Councillor Howard said, self-harm, because that is just so worrying. And there is probably a correlation between mental health, self-harm and substance abuse. And if Councillor Grant's saying that we are the fifth in the country, and there's definitely need to be or to be better focused on this area.
Yes, Councillor Elliott.
And yes, we are 5, but in fact, that's become worse because we were studying at 6. So in fact, we've gone up the wrong way up the table. So I agree with what has been said. I think, looking at this report, and thank you, Caroline, I think it has got some very good information in. I do take the caveat from you about, some of the figures, etc. Appreciate that, your honesty in looking at that. This committee, its role is to look at and improve inequalities. And I think, glaringly through this report, in every single area, it is those inequalities that are screaming out at us, and those that we need to do something about to raise and to change the lives for the better for the young people in our community. So I look forward to the report which is coming in due course. But I think I absolutely agree with you, Faye. And I think that mental health and self-harm, really, if we can't address anything else, then we should definitely look at that, because that is such a horrific area. Yeah, I would call that.
Is there any particular way shall we move forward in looking at self-harm and mental health? Task can finish, or shall we just leave the officer for another report in due course? Then take it from there.
I think we can't ignore this, and I think that, obviously, Councillor Howard has touched on the points that I raised as well, and it's great. And I think, like with the alcohol, the absence at school, the knife crime, all these link into one, and that's the reality of it. And I think as a community, we need to deep dive further with this to make sure our policies are right to help and support those young people.
Yeah, so maybe a report on how it's being addressed now that it's come up. I mean, I think this isn't just us shouting that, this is other people, and then monitoring the statistics going forward, I guess. I think the stuff in Great Western might not be too hard to find. Some others might take a bit longer, but I think this is an issue we've raised. How is it being addressed, and how are we monitoring to see whether it's working?
So we'll monitor further. So one should have further report to see improvement. I don't think we can ask one for the next 3 months because there's potential changes. So shall we say, obviously our next meeting is in April, 9 months time?
9 months, 6 to 9 months, I would say.
Is that okay? We'll have another report in 9 months.
Yeah, I'd be very happy to bring that back, and let's say there's lots more you can do.
Thank you. Thank you very much for the report. Thank you. Okay, unless anybody else has anything more to add, contradiction, then we'll move on to the next item, which is Swindon Council Youth Services. And so Amanda Spade, who's presenting the report.
Yeah, I'm going to present the report, but I will introduce Amanda as well. So Amanda Smith is our head of service and intervention youth communities. She wrote the report. Amanda started with us 2 weeks ago. It's a permanent position now, so very new in post. And she's joined by Fee Cisneros. She's our Director of Safeguarding and Support. Fee has been about a month, so they're here, but they may not be able to answer all the detail of the report, but we can obviously take things away as needed. So I just wanted to introduce the report and run through a few things and say, this report is very, although the report is a few pages, there's lots of other information behind it that feeds into it that you really sort of need to be aware of and probably spend a lot of time reading. You can probably get lost in all of it because there's so much there to understand about the offer that we have as a council. But just to highlight a few things that, as it says here in 313, that the report supports the Swindon plan about building a fairer Swindon. And it's a programme of support that supports our wider work with children and families. There's a link on the beginning around our early intervention support for children and families. There's a whole section on the council website and the local offer around the offer that we offer to families, to children and young people, and the graduated response that we offer there. And it lists all the different things that are available for young people, children and families. And I think it's certainly worth looking at the local offer website that the council has, because if you have any questions about what is available, it is all there. Just to mention a bit about the governance of the youth service, that is overseen by the, as it says in 3.1, by the Swindon Safeguarding Partnership, the Early Intervention Youth and Community Board, and that's chaired by Andy Malcolm. He's the Chief Exec of Smash Youth Project. And I think it's worth mentioning as well in the report that the youth service takes a graduated approach to meeting young people's needs in response to a thing called the right help, right time. And that's about, and there's a link to that guidance there about intervening at the right time to provide the right help. You know, I think those of you of my age will remember that we used to have universal youth services everywhere. When I grew up, I used to go to a youth club in my village. And when I first came to Swindon, I volunteered at youth clubs, and we had youth clubs and play schemes, open access youth clubs all across Swindon. Things have changed now, but we're developing, as it says here in 3.3, the base as a universal youth facility at the Lyndhurst Centre. And then as we go through these graduated levels of support, targeted support for youth engagement workers in the locality teams, specialist support through youth justice and the Opal child exploitation team, educare service, youth justice for young people that come into contact with additional services there. And then the Youth Endowment Fund, which links through to the base and the funding that we've received for that. Then also U-Turn, which is specialist support for care experienced young people. I think it's also important to note that young people's voices are heard throughout the design delivery of the service. And I think a number of us as councillors went to the base yesterday to see at Lyndhurst to see how it was coming along. Councillor Amin was there as well, and that is a really good example of how young people have been involved in the whole design of the whole project from start to finish, including the building work and working with the contractors and actually telling the contractors what they want, down to how the rooms are laid out, the design of the building, making it all accessible. And I think that's a really good example of how that children's voices come through. I'm not sure if there's much else I could say. I was going to just pick up on the previous discussion as well, that what we do have as well is we have a youth partnership that meets on a quarterly basis, and they have been working on a strategy called Harm Outside the Home, and there is going to be a strategy announced on that fairly soon, and that is a partnership that meets quarterly of all the sort of youth services in Swindon, and we do invite other partners, police, health, education, and parish councils as well. I think I'd like to see that, that is going to be the way forward as well, is partnership working across the whole of Swindon. I think I'll probably shut up now. But we just want you to consider the report. and provide any feedback of areas you think we want to focus on further. And if there's something very specific that you would want us to come back and talk about, in particular, there's the early intervention youth and community strategy, which was released last year. That's a 4-year strategy. There's in the appendix to that, there's a whole list of other cross-cutting strategies, and there's a list of the metrics that we will use to monitor that. So, because like health, this is so big, you may just want us to come back in future and pick up a specific element of youth activity. One of the services that's mentioned in the graduating service, and I suppose the final offer is when the base is up, and then I'd like to invite all councillors to come and have a look and see what's going on there and meet the young people. Should I invite Fee and Fiona up? They'll be able to take any actions away if there's anything you want.
I think the investment is a really good example of the medicine we did yesterday. And, yeah. Well, let's welcome Amanda to Swindon Borough Council.
Thank you very much.
Any questions?
Anybody got any questions? Councillor Howard first, followed by Councillor.
So obviously with the youth engagement, you're going to solve our mental health by young people and all of the other problems, aren't you? No, but it is very well tied in, isn't it? And it is great to know that we are, and I love the fact that you're hearing the voice of the young people in the styling and everything. For me, the big question is, are we reaching the right people? How are we, the big long thing that we had just before talked about the different demographic, and we've heard that children in some of the more affluent areas are more likely to get the diagnosis and the support they want. My worry is these same children are filling our youth centres, and I know it is kind of targeted, but how are we monitoring that? How are we making sure that we're reflecting the demographic of Swindon and the children that we really need to, and not those who are perhaps first to the door, which does happen.
Well, I think that's a really complex question. I don't know that. No, it's a good question, but I don't. When we talk about children and living in more affluent areas and not, I always feel as a safeguarding officer, I always feel that I need to qualify that with harm happens inside the home, in every home, not every home, but in every demographic down the social strata, but it also happens outside of the home. And that is in the reports, that is something that I would certainly welcome here, because my last was Croydon, and so we did a lot of work around contextual safeguarding, and I'd like to bring some of that here, because we want to look sometimes outside of the parental capacity and work with families that are unable through outside influences to look after their children. So the more youth provisions we have, and we're welcoming of the base, but there are other areas with our young people that we need to really grapple with and understand. And we don't, yes, I'm sorry, because we don't know all the buildings and we don't know the offer, but we know through our numbers that are coming in, because I'm responsible for the MASH, and so we know the contact and the referrals that are coming in. There is a lot of risk abuse, which is attached to the substance misuse and alcohol misuse and domestic abuse. Domestic abuse is very high here in Swindon. So just trying to understand the right service at the right time with the right child and the right family, and how to address that. And we can do a lot of that in the youth service in the early intervention, because we don't want to, as Caroline said, we want to absolutely make sure that we're working with families before it gets to a position of then looking at care.
Yeah, Councillor.
Thank you. Thank you so much for the report and for high-level overview of the youth services provision in Swindon. I have a question to Chancellor Dixon. I would just like to understand from your perspective, where do you see the current gaps in the provision and what is your ambition? Which area would you like to improve?
I think really I'd like to see more universal provision across the town, and I think improvements in partnership as well. We've got some really good partnerships developing, between the police, health, between the voluntary sector, and I think it's not really a gap, but I think that the whole Swindon plan and what we want to do as a council around Fair Swindon is about partnership working. So I suppose improving and maturing those partnerships around with all sectors would be my ambition.
Thank you. And I'd like to hear what you're saying about universal provision, because I spend lots of time doing engagement with local charities for the past year and a half. And the feedback I get often is the service from 9 a.m. to 5 a.m. But what happens in the evenings? They are children, and then when they struggle, there's nobody they can contact. And some of those local charities are kind of stepping outside of their business provision, where they actually have those relationship with these children, so they're actually helping them. It's kind of not within their meaning, but they do it because they want to help them. And I think that's kind of like luck. What happens? What happens at 12 o'clock in the evening when somebody's in crisis and they need to speak to somebody? And this is where it probably leads to self-harm, and we have problems with mental health, and there's an impact on our own children and youth.
Yeah. And I think some of this will not just be the council. We can see that there's quite a few groups, parish council supporting youth provision, new youth centres. There's church groups offering youth provision as well. And I think that just that sort of universal drop-in youth provision is really needed as well. So across the town.
Thank you. And also just to follow that up, actually, I would like to take into consideration a lot of the services commissioned to voluntary organisation. And I'm just wondering, how are we measuring the success of the voluntary organisation? Well, we see, my understanding is also that obviously when somebody comes into the system, they only have a certain sessions, and what would be the outcome of that session, and what's that session finishing, whether it's 6 sessions or 10 sessions throughout the
Yes, I'll say.
Firstly, can I say, I mean, we are a 24-hour service, so if there is crisis or anything happening in the community, then we're 24 hours, so we would always attend to children's mental health needs or any needs or domestic violence, anything that cause need or harm to a child. We're there 24 hours and we do respond. The sessions, we're very much, and we have met with all of our services today, we're very much looking at the unique child living in the unique family, whether that's within our care or within their own family setup. So we're less prescriptive, and certainly we're really pushing for making sure that we're offering a smart service and a targeted service, that we're not within a family's life, because we are the state and we want to make sure that we're respectful. So that may be for 2 months, or it may be for 9 months. So it's very much less prescribed, but more around that unique child and what the needs are within early help and prevention.
Well, my understanding is because there's so much demand on the service, obviously you've got to get certain people out of that demand to include the further cohort of the service. And that is probably one of the reasons driving out in sessions where you've got a number of things.
So we have regular checks and balances, and we have regular reviews with all of our children when they're in either early help and prevention or the statutory services. But our rate of re-referrals for Amanda service is very low. So they're working as a family in a very targeted way, and they're working with over 600 children, and 89% do not come back through the front door. So it's a service that are completely committed to, and I say this with assurance from meeting so many of them today and looking at their data. They're very committed, and they've got parenting groups, they've got a very good, strong offer. And so the rating, so the data tells us that they're working in such a smart way that very few families come back. And when they do come back, it's still at the early help level. It rarely comes up to statutory services. So that's impressive.
Yeah,
Brilliant, thank you.
and I think, sorry, if you look at, section 3.3, that there are very specific services and specific intervention with young people. If they're coming into the youth justice service or the edge of care service, they're assessed, and a work plan and a plan of support is worked out with them, and they work through that to sort of achieve the outcomes that they want through the assessment. And then, they're not there all the time within that service, and then they move on. I think the other point as well is thinking about the early intervention youth and community strategy. We're looking at how we can monitor the data there through Contact Swindon and set up data monitoring systems through that. And it may be something that the committee wants, as the strategy's been in place over a year, to come back and look at how that is being monitored and what the outcomes of that strategy are, and the performance of that, because then we'll be able to get the data and say how the strategy is performing, and it's written into the strategy that there will be a review of the performance against it.
Brilliant, that would be really welcome. Councillor Paddy.
Thank you, Chair. I would declare I'm the Chair of Parish Council before I ask this question, Mr. Councillor Dixon. You mentioned earlier about you working and engaging with parish councils. How many parish councils have you worked and engaged with?
I'm not sure, sorry, not sure I actually said I'm working with parish councils. I would say I would welcome the parish councils. I think some of the parish councils do things themselves because they want to respond to their residents. And I've seen, so the parish council are more familiar with Central, North and South Swindon, have set up youth clubs and they're doing positive work. I know that the youth workers in the council link in with the work that they're doing in Central North around the base at the community centre there. The youth and community network that meets quarterly, there was an invite to the parish one of the parish councillors to attend. They didn't attend. I would like to see that we can engage more around harm outside the home and the youth and community network. And so I'd certainly like to follow up with you afterwards and talk to the team about getting parish councillors more involved in that youth and community networks. I think we can learn both ways, and I think that if you're looking at developing youth provision, it's an opportunity to engage with the police, health workers, and other professionals and things around knife crime. There was a really interesting discussion at the last meeting around knife crime, and where the police and multi-agency partnership targeting in the central ward that had made really good results. So I think there's a lot of opportunity there that I think we need to embrace and take forward and work in partnerships. I welcome that further discussion with the parishes, definitely.
Yeah, thank you. I thought you said that you engage with them, so it's just understanding the gaps, because there are gaps.
Yeah,
no. For the certain areas, I think there are some areas that aren't being addressed. But understanding like how many have we actually reached out to, and what are the gaps? If it's 3 we've done out of 20, or is it more than that? It's just understanding where we are currently on the journey.
I'll take that away and have that discussion. Yeah.
Could you circulate numbers to 40 so we can understand how many have engaged and how many need to be done more?
Yes.
All right, brilliant. Thank you.
Thank you. Anybody else got anything else? No. Obviously, we've got another report from the previous one, which is children and young people with assessment. Is there anything from this particular report that we want to deep dive on anything, or do we part of the Dixon ourselves? Yes, and there will be a further report on data. Shall we just note that? Thank you very much. Thank you, Amanda. And once again, welcome to Swindon Borough Council.
Lovely, thank you.
Thank you.
Enjoyed it so much.
That's good. Thank you. Our next one is council's motion, Swindon social cohesion in the town. And I've got Councillor Grant and Helena Robinson.
Thank you.
Yeah, this was a motion passed at full council, two full councils ago, I think, and it's about how we address social cohesion in Swindon. Helena is the author of the report, and I've presented to you as tabled, and we're happy to take any questions that you may have.
Anybody with any questions? No? Well, that can't be that straightforward. Yes, Councillor Howard.
I wondered, I wrote a couple of notes to myself, one of which is how to monitor our staff background, gender, health, how do we compare so that we make sure that we compare as a borough council to what representing Swindon, I think that was one of the questions. I don't know if that's
And sadly, I'm not a person that's going to be able to answer that specifically, but I absolutely will take it back. So that information is kind of held with our human resources learning organisational development team, and we do hold that information. I absolutely know that, and we can, we will be able to look at representation, and we can kind of do that comparison. So I'll put that as an action to take forward.
Thank you very much. And I actually ought to say, I mean, I did the citizenship ceremony today, and I love the citizenship, and it's just amazing. And it's Swindon Day as well. This is so cool. Anyway, so love. I mean, how? Yeah, and I hope we are always. We always have lots of social cohesion in the town. And then 3.12, I just wondered, because it talks about everybody being involved, I just wondered, is it an issue getting everybody on board, or are everybody on the same wavelength, really, I guess?
I think from my perspective, kind of coming into this relatively recently, I do get the sense that there is absolute kind of intent and around collaboration, that as a town, we can only do work like this if we work together. So I think probably, previously, maybe we've sort of limped along in that kind of partnership approach, but actually I do, the kind of sessions that I go to, particularly around the work that Sam, my colleague up there, does around the community safety partnership, that's really starting to kind of move into the arena of not just very focused on that community safety, but actually what does that mean from a wider community, that holistic view of people? How do we ensure that we're really, we've got eyes and ears on the ground, that we're listening to people who live and work and kind of come to Swindon, so that we really understand what's happening and we take that into service design and service delivery. So it feels like we're moving really kind of further forward in thinking about this as a Swindon approach, as opposed to a local authority versus a police versus fire. So probably, further to go, but it feels right. I don't know what you've got a view.
Yeah, I think I think the motion originally came out of what happened in Southport, etc., and the riots and whatever. And I think that rightly it's focused upon the diverse communities within Swindon. But I'm keen that sort of that we take this further afield and to all communities. And we need social cohesion. Is a factor in every community in our town, and we need to ensure that we make it work in every community in our town. So whilst it's focused arguably on diverse communities, I think we can expand it to the wider communities around Swindon.
Although obviously in the report it does mention about a particular working program, and that's that is more to do with police, and probably obviously we're working in partnership with the police as well. Now I know the program has always been an area with complex issues, But with that work, how much do we think we have progressed? That's particularly with broad green.
Just on, the, it's called Clear Hole Build is the project, and for those that aren't aware of it, essentially what happens is there's an area and the police go in and clear out all the, how can I put it, ne'er-do-wells and the people, dealing drugs, etc., the criminals. And the hold element, when they've done that, the police, council and other agencies work to ensure that that vacuum isn't then filled by other people. And when that is secured, then the build, which is largely council and communities work, is how do we build that community up? My view is that there's severe challenges in trying to do that in Broad Green, but they've done it. But I think that template could easily work all over the town, and probably more easily in some places in the town than Broad Green.
I think I would just add that, that thing around the build is about capacity. It's also about celebrating the strengths that exist within a community and really kind of tapping into those to then, make sure that, as Councillor Grant says, that vacuum isn't then filled with something else. So, we come into our own in that build space where we think about what people have got to give, how they can contribute. Yes, we tackle the issues that people face, but it is about how can we do that with a kind of asset lens, really, rather than it just being kind of a place where we've got to solve issues. Because actually together, both from a council and a statutory and voluntary community sector space, but also from the residents' perspective.
And I could just add to that, with going on what we've previously talked about this evening about deprived communities, as it were. Then there's an element here that we can use this Clear Hole Build, as it were, that template in those communities to ensure that once they are in that build section, we do build a social cohesion within all those communities.
And would you say we are in that build process as it stands?
So we're currently in, I've got Sam up there, so please come down, Sam. So Sam is leading the Clear Hole Build programme from our perspective, is the strategic manager for community safety partnership. So Sam is writing the strategy, knows all the stuff, so over to you.
Yeah, so in terms of progress, we're just about to start the implementation of Hold. It was a new project, something that the Home Office has instigated for the police to take on, and obviously timescales to conduct the kind of clear phase initially might look like it might be a 6-month job or however long, but yeah, we're just about to initiate the whole phase.
And do we have any sense of time till when can we move on to other areas? I mean, there are areas like parks, Woolport,
Yeah, I think at the moment there is, certainly from a police perspective, they are looking at the data around, because essentially it's where the organised crime groups are operating the most, and that they've got enough intelligence to suggest that. There are other areas that they are considering as the next steps, the next places within Swindon. I think we're very keen, as it being a new initiative, that we make a success of the 3 stages, potentially before putting resources into starting a new project, because it is, although it's supposed to be business as usual, it is very resource intensive, and it is a new process of working. So very keen that we kind of do those 3 stages first, evaluate where we've made noticed successes, but also eventually rectify some of the issues that have happened during the Broad Green general build.
Thank you. I think on the report you've also mentioned in terms of the social cohesion that you are working with groups like City of Sanctuary and the Harbour Project.
Mm-hmm.
What I would say of the City of Sanctuary and Harbour Project, they actually work with a particular group of people, but there are so many wider communities in Swindon. There are other associations. One of them is probably Bangladesh Association, you've got the Hindu Association. How much work are we doing with all those communities? And are we aware of the benefits that these communities are already inputting, which I think we've also already discussed at one point, that obviously these are probably not being seen because obviously they are not directly involved with the council.
Yeah, I think the amount of work that associations and community groups do is amazing, and you know, we really do need to recognise that. The Community Connections Forum is probably the closest thing we've got to in terms of reaching out to both faith groups or community groups that exist to support other individuals. So we have a group of both faith leaders but also community leaders who tend to be kind of self-appointed community leaders, but come with a voice and insight about the communities that they are supporting. So our Community Connections Forum currently meets bi-monthly. There are also individuals that we could contact at any point. And I think what is wonderful about Swindon, and it's one of those things that it's really difficult to kind of write in a report, but is the warmth and the generosity of individuals and groups to support one another. So, you know, when we're faced with a situation where, you know, we find a family in crisis, or we find a group of individuals that need support, we can ask, you know, our networks and our kind of wider friends within, you know, our professional friends within groups, and they will come out every single time to offer their support.
Thank you.
Can I just add to that? The council and the administration is taking, you know, working with communities much more seriously than it has in the past. You just need to look at Helena Robinson, Director of Integrated Communities. We've never had that role in the past. We now have a whole directorate entitled Stronger and Safer Communities. We never had that in the past. As Helena says, we are now liaising with faith groups. We went with the police last Friday, faith groups at Gable Cross, and I've been out at God knows what time in the morning with Faye, with breakfast with faith groups over at West Swindon. And so we are trying to make those links. And as you say, Chair, you know, with all communities, both diverse communities, faith communities, and other communities, community groups that we can hopefully cohese, if cohese is a word, all those together to make for a better and fairer Swindon.
Thank you. Yes, and as I say, you know, there are so many groups and there are so many events happening in Swindon. You know, as I say, the Hindu puja, they've got puja almost about 3 or 4 times a year. You've got other groups as well. You've got the Mela, which is going to happen next year, and it's always good to publicize those ones to the council as well. And obviously getting everybody on board, that is what social cohesion is. Brilliant. Councillor Parry.
Thank you, Chair. The grant ICB, how much is that? Like income residents applying, what process is that kind of gone through to get to there? Like who is the judge and jury, how much that funding goes? We've just talked a little bit around. I think it's quite good for the community as a whole.
Yes, of course. So it is a small amount of money. So it's between up to £10,000 that we've been given by the ICA, and it's specifically around hypertension. So it is around how can we support residents and communities to ensure that they are kind of safe around blood pressure, high blood pressure. So what we are doing is, as part of that Community Connections Forum, we are inviting the people around the table, but also asking them to extend it to community groups that they're aware of or individuals that they're aware of. And they will basically, they pull together an idea, so up to £500 worth of funding to say how they might be able to raise awareness of hypertension, high blood pressure within their communities, and what they might want to do around that. So it might be that they decide that they want to run a healthy eating cooking club, or they would like to bring in someone to do some physical activity sessions. So really it is kind of a bit of a blank page we ask, what is it you'd like to do? How do you think that that would impact on reducing hypertension and raising awareness within your community? And then, forgive me because I can make sure you know this because it is written down in a process, but it follows a process where a decision is made based on that application. So I'll make sure that I've got that process. We are currently a member of the public health team actually. Is the one that's kind of administering that. So there will be a process which will show exactly how someone applies right the way through to how it's awarded and then kind of the review after that.
So when is it starting? How do we signpost residents to?
It's imminent. So what I'll do as a result of today, I will go away, check in with the individual that's coordinating it and then get a response to you around when that begins and when people can. Yeah.
My understanding that has already begun actually. Well, I've been contacted by someone to organize an event of hypertension within the community, which I'm doing. I know I had a few dates which were not suitable for the community, but I am on board with that.
Sure. Yeah. So I mean, the work around hypertension is kind of broader. That particular piece of work we haven't sort of kicked off the process, but absolutely, the last Community Connections Forum. We had a long conversation about hypertension, high blood pressure, and so so the conversations. That's really good to hear that the conversations have started and the work is being planned. I'll just pick up the specific bit about the grant funding.
Thank you. Anyone else? Anything? No. Thank you very much for the presentation, and thank you, Councillor Tanner, as well.
Yeah.
Okay, so the next part is basically we're coming to an end. So working program. I think on our next meeting, we will be having again quite a long agenda. Is there anything else from that meeting anything else that we take up as a way forward working program from that meeting, or shall we just go what we've got on the next agenda? Yes, Councillor Elliott.
Thank you, Chair. I think that your conversation was had between us and community services, and it was felt that the next meeting would benefit from us concentrating on, if you like, some of the areas that impact our children in the borough. And I think even more so after the report that we heard this evening. And I think the items we've got on there will allow us to look into that area very effectively. There's some good reports coming forward. I personally would not want to extend the agenda for this moment in time, so I think that gives us quite a lot to get our teeth into. I do note, however, that and as we discussed, the homelessness reduction still hasn't been, and I think that we should seriously consider that for the next municipal year as an item that we should consider.
Next municipal
Yeah.
Sure. So in that case, on our next meeting, which is on the 2nd of April, we will have communication with community engagement and partnership, need, tenant scrutiny, and behind every door, which should have been today exactly for some reason they couldn't.
That's right.
And we will also have support for people moving from education to employment, and education provisions for young people who do not have English as their first language, education. And I've also had a request from Health and Wellbeing Board to consider an item related to higher rates of dementia within the minority communities. Is that something the members are content to look into as well?
Absolutely. Yeah, I would say maybe a future, and I would trim this down a bit as well, because next year we're moving to 4 meetings, aren't we?
Yes.
So I would suggest, the local plan, have we taken that bit out then? Is that?
No, I forgot about that actually. Thank you for bringing it down.
Because I think if we're focusing on education, then that's a good meaty thing to focus on. local PAN could maybe, if we're going to 4 meetings a year, move to another one.
Sure.
I mean, I would move communication in communities as well, but so that it was all on education, but that was just what I would do. Yeah, I think 4 meetings a year is sensible going forward, because there is lots of stuff we need to look at.
Oh, no, it is 4 meetings a year.
Sorry?
It is 4 meetings a year.
Cool.
Yeah. And I was definitely talking about what's coming up on the 2nd of April meeting.
Yes, no, I know that, yeah.
Yeah.
And I agree, I think dementia and, different, it's worth looking at for a future.
Yeah. And shall we also include the local plan of the next meeting?
I think shove it back a bit, I mean,
Shall we back a bit?
because we've got an extra
Yeah.
meeting to play with. Right, then we can really concentrate on its an education
Sure.
focus, and we're not getting different people coming in.
Okay, thank you. Yes.
I just, I think Councillor Dixon's going to come in and talk about the children bit, but how does it play that, I know there's no election, so everyone will still be a councillor after the next meeting, but after the AGM, it may well not be that the same people around this table are around this table, and you may not want to tie the hands of the next committee, I don't know.
No, and that's why I'm only talking about the next meeting, which is on the 2nd of April.
So you're not going to go beyond that?
No.
Yeah, there's a lot of items there. Are you expecting a single item on all of those subjects? 1, 2, 3, 4 separate items on children's services education. I know the neat one is an overview, so you can then get an understanding perhaps for a deep dive. I just wondered whether you considered any other way of doing it, or whether you want to spread some of that across the whole of your future work programme, and whether there's any synergy or conflict with children and adult scrutiny, whether Councillor Cobra, are you covering any of these in children or adults, or have you passed these all on to this committee? Because to do it justice, you really need 1 or 2 items, not half a dozen. You'll be here all night if we provide comprehensive reports, and I'll just leave it with you to consider that, or maybe have a bit more discussion with what you wanted in those items, whether you do just want an overview, or whether you really want a deep dive on those, because you can develop a work programme for the next 3 or 4 meetings, which might be.
I think if I can propose it, I mean, let's have that need which is already ongoing, and let's not go ahead with the rest of them. So because we've got Emma Kay who will be coming at some point, and Emma will probably cover a lot of the attainment and.
Well, let me have a conversation with you outside of this forum, Chair, and I was going to suggest you might want to have a conversation with the Chair of Adults and Scrutiny, because tonight I think there has probably been a bit of a crossover, yes. And it may well be that if you two, or whoever the 2 chairs are in the future, can develop some, because a lot of, this is essentially a public health forum, largely within the adults and children section, so scrutiny committee. So you may want to have a discussion about what you want to do here and what the adults and children scrutiny will do, because you are scrutiny as well, aren't you?
Thank you. Just with my other head, I would probably suggest, if you already want to have need coming to April, in children's and adult scrutiny committee, we're going to be looking at education and employment training in December. So if you do very high level and you pick up areas, then we can tailor it down when it comes to our committee. So we can do it that way, kind of work in conjunction if you already have it on your forward plan. But also actually we have our quarterly meetings where we go through the agenda items to make sure that we avoid any overlaps and duplications.
Sorry, I mean, it is the job of the Adults and Children's Scrutiny Committee just to scrutinise. Whereas I think here there's a wider brief, isn't there? Yeah. We're looking at policy going forward. So how you compare those, I'll leave that to you.
Actually, it's scrutiny only one part of the role, also there's overview. So in remit, we are very similar.
Well, in which case you should be doing the same thing.
Yeah, so that's why we have a duplication.
Or maybe, I think, quote in terms of reference on the council website.
The only thing I would say, Jim, is that this agenda suggestion for the next meeting came out of the quarterly review with all the chairs of
That's
DAO.
right, yes.
And that's why it's on here.
Oh, well, if you've already discussed it, then off you go.
Do you?
Yeah.
Shall we leave it as it is, or shall we cut down?
Can I propose that we don't add to it, but that you
No, we're
reduce
not
it in
adding.
discussion with the other chairs, and we're happy with that, as long as it's nothing added.
Yeah.
Does that seem about be right?
No,
So
added
that
stuff,
means
yes.
we-
Yeah, nothing
we-
added.
Okay.
Yeah, and I would say that's 6, isn't it? I would say no more than 4 personally,
Yeah.
but. So that's.
May I just ask, in terms of the items on there, are any of them likely to present an issue in terms of getting a report or to that meeting? And therefore couldn't do it justice.
I think it's just capacity, really. You know, if you're asking officers to write four separate reports, this capacity, I prefer that you slimmed it down and concentrated on one or two items, bearing in mind officers are working on, you know, the Ofsted improvement plan and other areas of work as well.
Thank you. I know that the neat overview is something that we really did want to bring to that meeting. And the other that we've discussed was the education provision for young people who don't have English as a first language. Because if we look back at the report that we saw today, with many areas in there suffered because people didn't have, they came from some of our unfortunate communities. And I think that's something we would like to look at.
Yeah, and I think looking at the terms of reference of this committee, it is around supporting the sort of scrutinising and policy development around what we're doing around the Swindon plan. And it talks about policy development in relation to education. So that's ideal, I think. Those two would fit quite nicely, definitely.
I will be happy with them. So if we just delete the education attainment and support for people moving from education to employment.
Was that what Councillor Elliott said? Yeah.
Okay. Everybody happy with that? Thank you. Well, I declare the meeting closed.